Good morning. This morning, we're going to talk about posture. The question I get frequently is, I have bad posture. What can I do about it? Can chiropractic help? Well, we even have medical terminology or titles, if you will, for this now. It's called the computer posture. It's called the smartphone posture. And it's even occurring in children as young as 6 and 7 years old. Why? Because we're in a head forward posture where the head is down and we're looking down for prolonged periods of time. So we know that the head weighs 8 to 10 pounds and that when it's off axis, meaning when it's bent forward, that the muscles in the back are continually trying to hold this head up. And it's not holding up an 8 to 10 pound object, it's holding up a 30-pound object. So go to the gym and tie a 10 or 20 pound weight to your head and neck and walk around with that all day. And you can appreciate the strain that this puts on the neck muscles and the back muscles, especially the upper back muscles. So in the past, we called this the military posture that we were trying to obtain, right? Remember the military posture? Head up, shoulders back, chest out. And that worked to a degree until soldiers and bridesmaids at weddings started to faint because it didn't take into account the fact that part of our posture has to do with our hips, with our knees, and with our ankles. Okay, now having said that, let's get it fixed. So what I'm going to do is I'm going to bring Q.M.E. in and I'm going to show you what you should be looking for and what a chiropractor should be helping you to attain. So Q.M.E., if you come in. So the first thing that we say is that the head, you can see Q.M.E. is forward with her head. This is pretty typical. And so the one thing we want to do is bring the head back. We want the ear to be over the shoulder. We want the shoulder to be over the hip. We want the hip, and you can't quite see Q.M.E.'s knee here, but we want the hip to be in line with the knee and the knee to be in line with the ankle. And if we can obtain that, then we'll have a correct posture. Now, the second thing I'd like Q.M.E. to do is stand against the wall. Q.M.E., if you would stand against the wall. And this is something that you can do at home. And this is called a wall posture. Now, how easy is this? If you could get up at work and simply go to the wall, get your shoulders back and your head in a line with the shoulders. And the one thing I'm going to ask Q.M.E. to do is simply take her right hand, place it on her abdomen, and push back. Do you see how the pelvis tilts backward? And that is so important. Now, immediately, the chest comes out, the shoulders go back, and the head is back. Exactly what we call the military posture. The one thing to remember that we can't see here is, remember, the knees always have a slight bend to them. And that helps align the hips with the ankles. Okay? I hope this helped. The one thing I want you to remember is that chiropractors and chiropractic can help in this situation by giving the joints mobility again, allowing those joints to avoid this stiffened, decreased motion. So I want you to look at this again, call us. We look forward to helping you.